So it's pretty evident to all of us that we're dealing with an unprecedented circumstance with Covid-19 around us, and that's affecting council services every single minute and hour at the moment in terms of changes that we're having to make to our services, what we do and how we work. I just want to talk to you a bit about what's happening, how we're going to be managing that moving forward. As of yesterday, we closed some of our Live Life Aberdeenshire services in terms of our gyms and some of our community halls and facilities. And we've seen this morning a number of our schools were not open due to staff shortages. And we've seen the announcement coming through from government as of today, at the time I'm filming this, in terms of the intended closure of all schools as well. What is happening from a council point of view is that we are following national guidance and the plan, as everyone is and ought to be, and we see a number of staff who are therefore very properly self-isolating if they have concerns in terms of whether they have got Covid-19 or their family may have, or they are someone at risk, for example, a member of staff who is pregnant. That means we're experiencing a reduced number of staff available to be able to provide services, and we have to change what we are doing accordingly in that respect as well as thinking about what is an appropriate service to provide in terms of the environment. So, for example, in terms of gyms, in terms of what is going to be an inappropriate facility to keep going in some shape or form. The backdrop, as I said, to all of this is following the national plan, and the focus there is to make sure we are slowing down the spread of the virus as much as we can do, and also trying to ensure we have enough capacity within our NHS and health and social care facilities across acute services in hospital, community hospitals, and in our communities as well, so that as more people do catch this virus and need medical support and health and care support, then we've got the capacity there to be able to deal with that. So it's a long-term plan and approach we're trying to take here in overall terms. Whilst we've been responding to those changes, we're now moving into a different phase. We're going to be more proactive in terms of making some of these changes as well. We will both seeing how many staff there are available to provide services, but starting to move to actually stop some activity going on as well. What you'll experience around you is therefore the council changing things, stopping things. Things may take longer to happen. What we'll do is communicate with you as best we can do, as quickly as we can do, so you're up to date as possible in terms of what's happening. But make no mistake, no misunderstanding, this is going to happen quite fast, and therefore you may know things at the same time that we do as well. That's the reality of the situation. We've got a really strong focus in terms of looking after our staff in all of this work, and so we have changed our approach to daily updates to all staff, looking at our duty of care for them, looking at our work in practice, PPE, and ensuring that wherever we're asking staff to work, that they are working in a safe and effective way as well, and making sure they can make informed choices in line with that national strategy that we're all following. So please be understanding and bear with us as things will change around you, and we make those changes through services. They may be quite profound, as I touched on, all in all. We'll communicate with you as best we can. None of us know sitting here today how long this is going to take or last for, and that means we've got an uncertainty in terms of how long these changes will be for. And when we get to the other side, if you could put it that way, in terms of when we've got a sustained situation with the virus and a spread, and maybe some treatment for it, then we'll be able to take stock and maybe unwind some of the changes we made to services, come back to normal, and also take stock about some changes that may continue on with as well in some shape or form. The other aspect that's going to be important for Council is to work alongside our partners in terms of Scottish Enterprise, Scottish SDS, the universities, public bodies, private sector bodies, trade associations, supporting local businesses and communities as they also are grappling and dealing with the changes that are taking place. We've seen announcements from both governments over the past couple of days, which we are taking close interest in terms of the financial support that's going to be available for businesses and for communities. And we, through the budget that was agreed today by Council, are going to be adding our support and our effort in alongside that as well. So very much a partnership and a team effort that we are going to be taking in terms of supporting business and communities. As I said before briefly, some of these decisions and changes will be taking place quite rapidly, and so what Council have also agreed to do today is to use different decision-making processes where they may be needed. And it could well be that there were fewer councillors going to be available to be able to deal with the democratic decision-making process, which is part of how the council works, and in that circumstance we'll go to a more streamlined way of making decisions. And alongside that, we may also be in a situation, most likely, where officers of the council are making decisions by matter of urgency, and also making decisions under the Civil Contingencies Act, where we just have to get on with things quite rapidly. And as I said, we'll keep people informed as we proceed and progress as best we can do. Part of what Aberdeenshire, I think, is about very strongly is about the strength and the resilience of our communities. We've seen that time and time again. And already I've seen people volunteering of wanting to try and help out their friends, their neighbours, their colleagues in some shape or form. And that's great. This is absolutely going to be a team effort to be able to get through this in some shape or form. It's not going to be down to just the council. It's not going to be down to just public services. It's going to take everyone to be able to work in that way. So there will be guidance coming out locally and nationally from the council and other bodies about how you can help to volunteer if that's what you can do or want to do. And that offer of help will be more than welcome. If you don't need that guidance and you just want to go and get on with volunteering, we'll absolutely keep it out of your way so you can do that. So please, don't wait for permission from us. Maybe take this as permission. Just go and help each other in the best way we can do, look after each other as we are proceeding all in all. We don't have an exclusivity of the best ideas or the right way to deal with this one. We're making sense of it in the best way we can do as we proceed. How we approach this will chop and change as we go on, depending on what that national plan is, the health advice we get. So we'll all need to be agile and adept in terms of how we work forward here as well. Final bit from me, as touching on, I think, is that the importance of looking after each other. And it's easy to say, but I really, really sincerely mean it. You know, that's a real strength of Aberdeenshire again, is the welcoming, the care, the compassion, the love and support that we show each other as a council and as an area. Please let's continue to do that, look out for each other, make sure you look after yourself, keep safe. There's a long gig here that we've got to navigate through, and I'm sure it's going to see the best of us coming out in some shape or form. So, final bit for me, I hope that's useful. More than happy to continue and I will keep communicating in terms of what we're up to from a council point of view more broadly, and would welcome any thoughts, suggestions, ideas in terms of how you think we could do things better, differently, and continue to keep on top of this circumstance as best we can do. Thank you.